Good evening. I'm sorry not to be with you. I want to congratulate both Shannon and Laurie for their persistence in working on a violence prevention agenda for Canada and organizing these very important town hall meetings. This is our Canada, and if we don't shape it to be better at violence prevention, then other people are going to shape it to allow too many people to be injured and traumatized by violence. So it's time to get serious about implementing violence prevention. 30 years ago, the UN General Assembly adopted a major resolution on the prevention of victimization and on rights and services for victims. It called for investment in effective violence prevention. But 30 years later, Canada still has levels of victimization as measured in the General Social Survey that have been going up over the last 30 years. We all know that the levels of intimate partner and sexual violence are totally unacceptable, and unfortunately we in Canada do not have a regular way of measuring these. We know that violence in Canada at 83 billion a year accounts for about 5% of GDP, and we know that science is just not used in such an important area. But there are some important positives. Those positives include an accumulation of very important knowledge that I brought together in this book that show that violence, if you follow the science and you follow some of the best practices, is reducible. And within a 10-year period, if we did the right things, we could achieve a 50% reduction in both street and intimate partner violence. So the sorts of things that would need to be acted on are the sorts of things that the World Health Organization promoted when it did its global status report on violence prevention in 2014. They're investing in early childhood and outreaching to youth in difficult areas, controlling guns as we do reasonably well in Canada, but also controlling knives, dealing with alcohol to avoid its nefast effect on too much violence, and changing the way that young men grow up in terms of their use of coercion and sexual violence. And we can be very proud of the fourth hour as an example recognized across the world as a way of reducing violence against women. In addition to the good news from the knowledge, we also know that there are many examples of cities in other countries that have been very successful in reducing street and gang violence by 50% or more over relatively short periods of time. Glasgow over a 3 to 4 year period after the diagnosis was finished. We also know that other countries have implemented real responses to victims of violence, services that meet their needs, police that inform victims and refer them, services in hospitals, action to help with PTSD and help with intimate partner and sexual violence victims. So we have some models from other countries. So what is missing? Well, what is missing is the political will to invest appropriately and adequately in the reduction of violence. If we took just 1/10 of 1% of the GDP and invested it each year over the next 10 years, we could reduce that 5% of GDP cost to victims in half. But one of the things we would have to do is to set targets, a 50% reduction in victimization survey rates of violence, and a 50% reduction in homicides, a 50% reduction in intimate partner and sexual violence. We could use the American survey adapted to Canada to measure that. A 50% improvement in the number of victims who are accessing the services that they need. So I hope in the course of your town hall today that you will discuss what needs to be done for implementation, including the importance of investing in it, of having a leadership center, of having training and setting the targets that I've talked about, which are eminently consistent with the World Health Assembly's recent resolution on preventing violence and the World Health Organization's vision for public health solutions to violence. Thank you.